Macrolides are a class of antibiotics, characterized by a large lactone ring, with one or more deoxy-sugar moieties. They inhibit bacterial protein synthesis, and are used to treat various bacterial infections. Macrolides are generally considered bacteriostatic, but they can be bactericidal at higher concentrations or against certain organisms. In this video we will discuss about some important clinical pharmacology pearls about these macrolides. So, let's get started. QT interval prolongation. Macrolides, particularly erythromycin and clarithromycin, can prolong the QT interval and increase the risk of torsade de pointes. So monitoring is advised, especially in patients with predisposing factors for arrhythmias. Erythromycin as a motility agent. Erythromycin can stimulate gastrointestinal motility by acting as a motilin receptor agonist. So, erythromycin is sometimes used off-label to treat gastroparesis. Azithromycin's long half-life. Azithromycin has an extended half-life, allowing for once-daily dosing and shorter treatment durations. This makes azithromycin convenient for outpatient treatment and improve drug adherence. Drug-drug interactions. Clinicians should be aware of potential drug interactions with macrolides, particularly those affecting CYP3A4 enzyme. Dose adjustments or alternative therapies may be necessary to avoid adverse effects. Alternative for penicillin allergies. Macrolides are often used as an alternative to penicillins in patients with penicillin allergies, particularly for respiratory tract infections and skin infections. In summary, macrolides are versatile antibiotics with a broad spectrum of activity. They are effective against a wide range of bacterial infections. Their ability to inhibit protein synthesis makes them valuable in treating respiratory, skin, and sexually transmitted infections. However, macrolides have potential interactions and side effects, such as QT prolongation and liver enzyme alterations, which require careful management and monitoring. So that's all for today. Thanks for watching. If you found this video helpful, let us know in the comments below which drug class you'd like to see clinical pearls on next. Keep learning, keep growing, and see you next time. Thank you.